All right. Well, good morning, everybody. And we're happy to see everybody here today. We are going to start our webinar in about 1 minute. So we see families joining us on Facebook and here on Zoom. So we're very excited to have everyone. If you give us 1 more minute, we'll let a couple more families join us, and then we'll go ahead and get started. Our webinar today is from UAB Eye Care, and your vision is your mission. So we're glad that you're joining us today. So without further ado, I think we can go ahead and get started. So Dr. Steele, welcome this morning. Today we have Dr. Beth Steele with us today. She is the clinic director for UAB Eye Care, and she's also a provider. And she will help us understand a bit more about how UAB Eye Care provides services to our students and also to our community. And just a couple of housekeeping items. There will be an opportunity for you to ask questions at the end. So please submit your questions as they come up, and then we will be able to answer those questions towards the end. So this webinar is going to be recorded live on Facebook, and then you can go back and view it at your convenience. And it will also be uploaded to our website, uab.edu/families, with captions within the next couple of days. So thank you, everybody, for joining us. And Dr. Steele, it's all yours.
Thank you, Carmen. Good morning, everybody. Thank you for joining us. We're excited for you to embark upon this exciting and busy time of your lives as you see your kids go away to college. Welcome to UAB. What we'd like to do in this webinar is talk about UAB Eye Care, which is an eye clinic on campus that we hope your students, the undergrads that will be on campus will take advantage of. So we're going to talk a little bit about what we can do for potential patients, for the students on campus, and then we'll do some examples of things that we see and reasons why you might benefit from that, and then happy to take questions. So plenty of time for that. So UAB Eye Care is a full-service optometry clinic. We collaborate with ophthalmology as well, but we're located right in the heart of campus. Next door, we are next door to the Lister Hill Library. So I'll show you where we are. On the screen here, you see my picture. As Carmen mentioned, I'm the administrator over our clinical services here at the UAB School of Optometry, and I'm also one of the optometrists, so I see patients. And then we've got Dr. Candace Turner on the screen too. She's one of our providers, and she actually sees patients over at UAB Student Health and Wellness. So we'll tell you how to see us at both of those locations. So we are, as I mentioned, the clinical arm or clinical operation of the UAB School of Optometry. So the UAB School of Optometry is this big, tall building on the screen right between the Lister Hill Library and what's called Callahan Eye Foundation. And we are just not even a block from the Hill University Center. So right within walking distance of just about everything, really easy to get to. Our main clinic is on the ground floor of this building. And our mission in our clinic is to serve the community in eye care and to serve those on campus as part of that community in order to not only provide great care, but also to educate our optometry students and residents. So we have a dual mission, and basically those two things serve one another. So we have a full service clinic where we provide comprehensive and routine care, a lot of specialty things that we do. And we also have emergency care. So something that happens on the weekend or, on an evening, we've got 24/7 availability for any sort of eye emergency. It is useful to know at this stage if your student has chosen the UAB student insurance, the UHC, United Healthcare Student Insurance. For the very first time, you might have noticed there is now an offering for a vision plan combined with a dental plan. And so we are going to accept that. We've partnered with Student Help to make sure that that's easy for students. Now, whether your student has chosen that vision plan or not, we still have great benefits and ways to get affordable care and glasses. And we'll talk about that a little bit later in the presentation. We have inside this building, it doesn't look like much from the outside, but when you walk in, the entire ground floor of this building where you see the UAB Eye Care sign is our main clinic location. And in the middle of that, the heart of that clinic is our optical services. So we have a full service optical with the latest styles and brands for glasses and sunglasses, really popular, nice current options. And again, lots of ways for students to save money. We certainly do not want to take you away from your local optometrist. If you are local to Birmingham and you want to keep seeing your optometrist out in Pelham or over in Homewood or whatever it may be, we don't want to take you away from that. But we'd love to temporarily care for you if it benefits you, if it's convenience in terms of location or pricing. We want to be your home for eye care while you're here. If you're away from home while you're at UAB, there's certainly going to be a way for us to help you out. So we want to make sure that that basically there's ways that we can help you, even if it's a situation where you don't really feel like you have any vision needs. And we'll talk about why else you might want to come see us. Here's some pictures of our optical services just to kind of show you a little bit of what it looks like on the inside. We have great staff, great quality products, and like I mentioned, the latest and greatest in terms of styles. When we think of specialty areas in eye care, so this can be really complex, but if you're out there and you have some specialty needs for eye cares, you can relate to this. So not only do we see, your run-of-the-mill eye exams for any age, patients of all ages, pediatrics all the way to, the aging population. For routine care, we provide care for eye diseases of all sorts. We provide care out in the community for people who are not able to come into our clinics. And, all the patients that we see in our main clinics actually help us fund that. When we're a business, of course, but when we earn money in our clinic, we actually are able to give back to the local community with our community service efforts. But in our clinic, some of the things that our undergraduate students and UAB employees and others on campus are taking advantage of are specialty contact lens services. We have vision therapy clinic that runs 3 days a week. We have a dry eye specialty clinic. We partner with UAB Athletics for a concussion clinic, and that can really serve any patient, that not just athletics, but including the athletes on campus. We have neuro services, all kind of specialty items that are not listed here. So just about anything with eyes, we can guarantee that we are a good starting point and we can get you the help that you need, whether it's in our building or somewhere else. We mentioned the community eye care efforts that we do, and just kind of highlighting the people that we serve. We have just dozens of different ways that we go out into the community, to the rural areas, the underserved areas, and help patients in need, mostly in Alabama, give glasses and make sure that these people get the care they need. So if you're interested in scheduling an appointment, you might think, well, when would I schedule an appointment? What would bring me to need an eye, an eye appointment or a routine vision appointment? And there's lots of answers to that. A lot of people will say things like, well, my vision is fine. I don't need an eye doctor. Or I don't go to the eye doctor because I don't need glasses. And so, yes, it is true that by and large, what we are going to be doing day to day is routine eye care. So we're checking patients who need glasses or contacts and updating those. But that's really more of the popular thought about what we do. It's really not what we are all doing most of the time. And so a lot of what we're doing in addition to that has to do with ocular disease management, whether it be something as commonplace as dry eye and ocular surface disease like allergies and things like conjunctivitis, pink eye, those kind of things, all the way to glaucoma and diabetes and things that can happen in the retina, and tumors in the eye and things that are much more complex. So there's a very large range and variety of things that we care for. We do recommend that patients come in for annual exams, depending on the age. So our recommendation is based on the standards that are created by the American Optometric Association. And so they recommend, and you see it on the screen here, but for school age patients who we're focusing on today, the recommendation, and that includes all the way through graduate school, basically, that the student have a dilated exam every 2 years or so. And within the last 2 years for any given time period. And that dilated exam is where we put in the eye drops, we look at the back of the eye, we look for any eye health concerns. But sometimes more importantly, what it's looking for are reasons that the student, whether it be a kindergarten student all the way to a graduate student level, is having any issues with their eyes or vision that can prevent them from being successful in school. And there's a lot of things that have overlap with what we kind of think of as difficulties in school and difficulties thriving that actually may be easily fixed with eye exam or vision therapy or special classes or even very basic classes. If you're a healthy adult without risk, every 2 years, but every 1 year for anybody who's 40 or over, and even infants age 6 to 12 months are recommended for an eye exam. Now, once we do that initial dilated eye exam, we determine what the risks may be, whether it be family history or findings or symptoms, and then we decide if there may be care that's needed a little bit more often. When we think about a routine exam, one of the things that gets a little bit confusing is the insurance discussion and what's covered. So we'll talk about that here momentarily. This is a picture of UAB Student Health and Wellness, which all of our undergraduate students should get to know very well. It's essentially across the street from UAB Eye Care, so right here, kind of near the athletic center or the rec center. And so we have a clinic right inside of this Student Health and Wellness Center where we go once a week. Dr. Turner, I showed you a picture of, is going to see patients there. She's going to do comprehensive eye care, routine exams, problem-focused exams, pink eyes, all kind of things, whatever walks in the door, including contact lenses. So we're excited to serve students over there or in our main clinic, wherever it's most convenient for them. Blazer Vision is about a decade-old program that we have in partnership with UAB Athletics, where we screen every athlete in our clinic for eye care needs, basic eye care and vision needs, and we do concussion baseline testing for these athletes so that if they're injured on the field, we can use that baseline testing to help us decide how quickly they should go back to the field or back to play. And so we are excited to help all those guys and have partnered with a lot of the teams to even provide athletes with vision therapy after their concussion so that they can return back to care. All this is evidence-based, scientifically based care that really helps the athletes get back to their sport as quickly as possible. All right, so how can students take advantage financially with UAB Eye Care? On the left-hand side of the screen, you see the insurances that we accept, and this is not an exhaustive list, but just to name a few of the most common. So we do take the United Health One Student Vision Plan that I mentioned earlier. We also, if you choose not to pursue the United Healthcare One Vision/Dental Plan, we also take the UHC plan by itself. It does cover a routine eye exam, but it does not cover the glasses and the contacts the way that the UHC 1 vision plan will cover. We also take Viva, which is a common plan in Birmingham because of UAB. It's an HMO, and Viva actually covers a routine eye exam, but no glasses and contacts. And there's a few others, Superior Vision, VSP is another common routine vision plan that covers glasses and contacts. And we take Blue Cross, we take Medicaid of Alabama. Medicaid also covers glasses, not contacts, but glasses coverage for students is great, really. We've got a great selection of updated inventory for Medicaid frames as well. Now, what if you don't have insurance, or if you have insurance, but it doesn't cover glasses and you need glasses or contacts? Well, we have a whole separate package for those students that don't have those other coverages, which is just basically a student perk package. We have an $89 green and gold eye exam that really students, employees, parents, friends, anybody in the community could take advantage of. And that's an eye exam where we offer a patient who does not have a routine vision coverage to come in and just get an eye exam done. We also offer for UAB students 25% of out-of-pocket expenses for their eyewear when they don't have insurance. We've got some other discounts that are specific to contact lenses. glasses, 50% off the fittings, the evaluations, and really 50% off of any other services that we provide. So if it's determined that your student needs vision therapy, for example, because they're having eye strain when they do their schoolwork, we offer 50% off of that service, or specialty dry eye services or concussion services, 50% off of all of those. So why do we do this? What's the incentive that we have? Well, there's twofold. One is that we are here to serve the community, and that very much includes the UAB community. And of course, that includes the students. That's our mission. That's why we're here. And as a result of being successful in that mission, we are able to succeed in our secondary mission, which is education, because the more patients we see in our clinic, the more experiences our student interns and residents have. So we all win when we are able to take care of those folks. What I wanted to do now is talk about 3 very common reasons that we see patients, or common reasons that we would recommend that you encourage your family to come see us or go see an eye doctor of any sort. The first one is just simply uncorrected refractive errors. It's a misnomer that a refractive error or a glasses prescription would always cause blurry visions. We're going to talk about that briefly. Then we'll talk about some common binocular vision disorders that can interfere with student success, some schoolwork type interferences. And then we'll talk briefly just about some examples of things that we see in terms of eye health. So first, the uncorrected refractive errors. You've got some statistics over on the left just to give you an idea of how common it is in the United States for any given person in the population to have a disorder of vision. 11 million or so Americans aged 12 or older could actually improve their vision through proper refractive correction. And what we mean by refractive correction is either glasses or contacts. So you might say, well, I see fine without glasses or contacts, and therefore I don't need glasses or contacts. And sometimes that's exactly right. Sometimes that's true. A lot of times, though, we find in a routine eye exam, when there weren't any complaints, that the patient actually would see better or would perform better, or sometimes would have less symptoms like headaches, eye strain, intermittent blurry vision that doesn't seem very constant if they were, corrected. Maybe they'd be more comfortable driving at night for things or other situations like that. About a third of the population is estimated to be nearsighted or myopic. And you hear about myopia a lot in the news because we're hearing now about a lot of ways that we can control myopia. And myopia is not just a disorder of vision. It's actually a disorder of eye health. If it progresses the way that we know it does, it can actually cause pathology and even vision loss, permanent vision loss in the eye in extreme cases. About a half of the population in the US have a correctable amount of what's called astigmatism. We think about the word astigmatism, it sounds like some, scary disease, and it's not. It's really just a misshapenness of the eye, but it's extremely common. And this is going to be where a lot of patients say their vision is fine without glasses or contacts, but they struggle to see details when they're driving at night, or they have eye strain when they read. So there's different types of astigmatism that can cause these symptoms. Farsightedness or hyperopia is less common, but in the younger population, so in our undergraduate student population, this is one that causes a lot of headaches and eye strain and trouble reading for prolonged periods of time. And it doesn't cause blurry vision, and so patients don't go to the eye doctor. So this is one of the reasons why we want to push people to come and get their eyes checked. Right off the bat, let's make sure we don't run into any problems with, trying to fit in an eye exam into their busy schedule once they get to midterms and finals and that kind of thing. What are the problems we see? Of course, reduced vision, headaches, eye strain, and even reduced depth perception, like I mentioned. The second real common reason we want to encourage people to get routine care and to get things checked out is because of binocular vision disorders. So accommodative and convergence disorders, these are bigger words to basically describe the function of the eye muscles that help us focus on any given target, whether it be the oncoming car in traffic, or the book that you're reading, or the digital device that you're looking at to study. Accommodation is what happens when we focus our eyes to see things clearly. And convergence is what happens with our eye muscles when we point our eyes, our two eyes point together at the same target, at the same exact place, in order to see things as one. Nobody likes to see double vision, but double vision is common and it's commonly misinterpreted when it's very subtle, but it's very common when there is a disorder of the convergence system. And both of these disorders are extremely common, underdiagnosed. They are misdiagnosed very often as learning disabilities, in fact. So about 1 in 10 patients are going to have one of these two disorders in a routine, normal, healthy, type exam. It's exacerbated by lots of medications, especially things like anti-anxiety and antidepressant medications, things that even our young healthy students are taking very often. It's exacerbated by stress. And the things that we want to look out for are headaches, eye strains. Sometimes the patient will say double vision, but oftentimes they don't. They might say they're struggling to study, to retain material, and they're just, not interested sometimes in reading or studying. And it's because their eyes are uncomfortable and they may not interpret it that way. So that's a real common thing that we deal with undergraduate students and graduate students as well. The third thing I wanted to touch on is just this concept that good vision is not the same as healthy eyes. There are countless disorders in the eyes that can occur in the eyes that do not affect vision right away, and sometimes will not ever affect vision, although they can affect systemic health. And so I'm going to show you a few examples of kind of scary things to highlight the things that we're talking about. So this is the inside of an eye. This picture here is the retina. You see this round structure, which is the optic nerve that connects the retina back to the brain. And you see some blood vessels. In this particular patient, you might notice a very subtle discoloration right where I'm taking my mouse. There's this kind of pear-shaped grayish brownish area in the eye that is it's what's called a nevus of the choroid. And this is the kind of thing that on the skin we would call a freckle. Okay, so you see a freckle on your arm or your skin, and you watch it over time, and you might look for change over time. And when it got real big over the last year, you go and you see your dermatologist. Well, luckily those freckles are where we can see them in the mirror or on our bodies, and so we're aware of those, right? And we go and we see a dermatologist sometimes just to do a whole body check, right? Just to make sure there's nothing that looks suspicious. Well, those same types of freckles can happen in the eye. And while it's pretty rare for those to convert to something malignant, when they do convert to something that's malignant, which is called a melanoma, and in this patient's case, her father had actually died, passed away, unfortunately, from a melanoma in the eye. When these do convert to something malignant called a melanoma, they metastasize to the liver. They can cause a very poor life expectancy. And unfortunately, it's not a very good situation, particularly if we discover it late in stage. So I can't tell you how often I see these benign freckles that nobody knew they had because they don't cause any symptoms. And so we need to see these, we need to monitor them for change, and we need to look at them every year. And so if you don't get a routine eye exam, you won't know you have one. Okay, so that's one example of something we see often. A couple of other examples of things that we see. These are all young, healthy, student age folks. Okay, so these are 3 different retinas. What we see in this 18-year-old Caucasian female, if you just look at my arrows, you see these black areas out in the retina. This is a patient who's nearsighted. In fact, all 3 of these patients are nearsighted. When we're nearsighted, the eye, I mentioned the pathology that can happen with myopia. The eye is not round anymore. It's really elongated. It's kind of stretched out. And when the tissues are stretched out, that can cause pathologic thinning, holes, and even what's called a detachment of the retina. And so all 3 of these patients, young, healthy, student age patients, have thinning and holes in the retina and have high risk for what's called a retinal detachment. So this patient over here has a very large hole with some detachment around it. And on the bottom of the screen, another patient who's 25, young and healthy Asian male with a very large detached area around this large hole. So these are patients that need to be monitored carefully. They need to be educated. They may benefit from a referral to a specialist. So these are things, again, we see these every single day, and they're not, they're in many cases, they are routine observations and education. But if we didn't have the chance to see them and to educate, then we could have missed something really important. Here's another very young and healthy patient, 21-year-old. This was a UAB undergraduate student that I saw about 5 years ago. She came in with headaches, and her optic nerves are both very swollen. I don't expect the non-clinician to look at this and see anything significant, but what you could see kind of in contrast from that other picture is that the blood vessels are a little bit windy and tortuous. There's some red stuff that shouldn't be there, that's blood. And the optic nerves are not as distinct as they should be. They are swollen with fluid. So as it turns out, this particular patient who was a single mother going back to school a little bit later in her life, having very severe headaches, it turned out that she had too much fluid in her brain. And this is a common thing in young females. It's not benign because it can cause exacerbating headaches and debilitating headaches, loss of school and work time, and it can cause vision loss if it's not corrected. So we were able to help her. We did a brain scan to make sure she was healthy. Otherwise, she didn't have a tumor. We did a lumbar puncture to determine that her brain pressure was too high. And then we put her on some medicine, and we helped her get with a nutritionist at UAB to exercise and to lose weight, which is one of the risk factors for this condition. So I've seen her since. She's in great spirits. She's totally turned her life around, and she's been able to stay in school, and she's in grad school now. So that was a success story, but it was a routine exam, just some headaches. So I tried to share some slightly scary examples so that you can see some examples of some of the same things we see, but other things include glaucoma, diabetic retinopathy. These are things that happen in young age people, but sometimes in the more aging population. So lots of reasons why we would want to see you. So on the screen now, there are some details about how to book your appointment. You can simply call 975-2020, and you can talk to one of our customer service agents. We also have a way to book online. You can use the QR code that you see over there to go directly to our website, which will link you to this link here where you can book online. And we really hope you do. When you go online, couple things to keep in mind. There's a button that just says schedule an appointment, but then it will take you to an outside site that links with our electronic medical records. And if you want to go to student health over across the street from us, which is going to be where hopefully your students are getting their care for, just primary care doctor type care, or anything that comes up, and mental health resources over there and that kind of thing too, then you click on this one over here, student exam over on student health at the student health location. You also could come here to our main clinic, and that's just by clicking eye exam. If you are a contact lens wearer, then you would click on the one that says contact lens, and we'll make sure you get to the right place. At this point, I am more than happy to take questions, and we'll see if there were any.
All right, well, thank you very much for all this information. I think the information how to book an appointment becomes very important. And I really, even though the pictures were a bit scary, I think it's very important for families to know that prevention and staying on top of things, and just like you would with overall health, is very important. And there's a facility here where students can go, even staff can go as well. So we encourage families to take advantage of this. They can either go to the eye care center here on campus or across the street at Student Health. So we encourage you to send us any questions that you have. Of course, you can always submit your questions later, and we will be glad to send those out to Dr. Steele or UAB Eye Care as you need. So Dr. Steele, I was really impressed about laser vision. I didn't even know that was being done. So that's an amazing opportunity also for student athletes. I know that we have lots of our students are going into different sports, and so just staying healthy that way as well is very important. One question that came up is what does myopia control entail? What does it involve?
So myopia control is the idea, the goal of that is to slow the progression of nearsightedness. So as I mentioned with nearsightedness, the reason a patient is nearsighted is because their eye is elongated. And there are a couple of things that contribute to that, but that's one of the one of the main anatomical differences with someone who has myopia or nearsightedness. And so we can't change the shape of the eye, but we can change the shape of the front surface of the eye called the cornea. And we can also prohibit the eye from over accommodating or that over focusing. And so there's 3 different methods that have been studied heavily for myopia control. Two of them focus on prohibiting the focusing or the accommodative act of the eye, which is thought to has been shown to slow the progression of myopia. And the third one of the 3 is going to really focus more on the shape of the cornea, where we flatten the cornea a little bit to slow the progression. So we have, for about probably the last 5 years or so, we've had a myopia control service, and we're practicing, evidence-based medicine with that. We've got a great team, and we've had a lot of success stories with that.
Awesome. Excellent. Excellent. Again, families, you still have an opportunity to send us your questions via the Q&A here on Zoom or on Facebook. I see that we have a couple families joining us on Facebook, and that's wonderful. Again, just a reminder, the webinar will be live, will stay on Facebook, so you can go back and view it with your student or other family members. And again, you can always submit your questions. You can email us here at families@uab.edu, and we will be glad to submit your question or refer your question to the appropriate people who can help you with the answers. I don't see any questions right now, but we really are glad to have Dr. Steele again with us this year. And again, we encourage students to take advantage, don't wait till it's close to midterms or exams. Take care of things early, just like you would with your health. And then visit your doctor if there's anything that encourage your student to visit the eye doctor if there's anything that they feel is not working quite well. They may associate it with excess stress or eye strain, but there's always it's always good to look into anything that doesn't feel quite right. Are there any last minute tips, Dr. Steele, that you would like to leave families with, or anything that you would like to tell them?
I think the kind of just to highlight on the fact that we do have a lot of options for making sure it's financially convenient for the students. We have a lot of different options to make sure it's efficient and timely and that kind of thing in terms of convenience for their busy schedules. So if you have any questions about that, just give us a call at the 975-2020 number. We'll make sure that that we're as accommodative as possible. And otherwise just enjoy your summer, and good luck to the students, the incoming students. I hope it's a great year, and we're glad you chose UAB. Definitely. We're glad that everybody is going to be here in the fall. And so just let us know if you have any questions. UAB Eye Care is always there to answer your calls and answer any questions. And so we wish everybody a great rest of your afternoon. And don't forget our other webinars. We have one coming at 12 o'clock with collegiate recovery, and we have another two tomorrow coming with counseling services and wellness promotion. So stay tuned, and we look forward to seeing everybody. Thank you, Dr. Steele, and we look forward to seeing you next year. Bye-bye. Bye-bye.